go with these recommendations. To reduce the burden of type 1 diabetes in the world at a minimum oral intake of D3 at 30 degrees or higher. Now what the current recommendation is for infants, the no adverse level is 1,000 IU per day. Or that's the National Academy of Sciences upper limit is 1,000 IU per day. So you can recommend right now 1,000 IU per day and be within that upper limit of the National Academy of Sciences. The actual no adverse effect level is 1,800 IU per day. So there's at least 1,000 IU there of a safety factor. And that's for actually children from birth to 12 months. Adults, the 2,000 that we've talked about repeatedly here and that D-Action is going after, and in children 1 to 12 years, 2,000 IU as well, with a serum target of 40 to 60 nanograms per ml. Probably one of the best ways to deal with this is what's currently being proposed, and that is to actually do serum measurements and get them up to a level somewhere between 40 to 60 nanograms. Well, now what would be the risk-benefit ratio, for instance, of 1,000 IU for infants in terms of type 1 diabetes? Well, if that's a no adverse effect level and you have the possibility of preventing 8 out of 10 cases, the risk-benefit ratio is infinitely large. And in fact, most of the diseases that we talk about today, because there are no adverse effects in adults at all at 2,000, the risk-benefit ratio is almost infinite. Any questions on this disease? Yes? Okay.
What adverse effects have been noted above those?
Yeah, that's what I was just going to ask.
What was the question?
What were the adverse effects above 1,800 when originally we were getting 4,500?
Well, again, I'd throw that to Dr. Haney or others, but I couldn't find in the literature, and I looked for it, any adverse effects reported from Finland with 4,500. But we, at this level of our state of knowledge, in order to fit within the guidelines that are currently acceptable by almost every organization, the National Academy of Sciences, we stay within those guidelines because they are quite a bit higher than what's currently done. Yes?
Does the National Academy of Sciences have a no adverse effect for a nanogram per milligram of serum?
Yes. We could do the conversion for you. Or you mean for a serum level?
Serum level?
Yes, it does.
No adverse effect?
Yeah, what would you say that is, Dr. Haney? And then,
We can.
okay, okay. Aren't asking the right way, okay. Dr. Haney will answer that one. He's the real expert.
No, what the National Academy of Sciences did is establish 25-hydroxy-D as a functional status indicator, but when they set the no adverse effect level, they were talking only about an oral dose. There was an inconsistency. We took step 1, but we didn't take step 2.
Yeah, your graph shows an increase around 1994.
Yes.
Was there any looking at that in terms of immigration into Finland from
other places?
Yeah. Africa or Southern Europe or something?
Well, that would fall into that category of some kind of a change in the population. And there was that, but that was, I don't think that played a big role in this, but I'll look into it a little bit more. Okay, thanks.
Thank you very much.
Thank you.